Hi, my name is Dr. Mathew Cherian. I am the Director of Interventional Radiology at the Kobe Medical Center and Hospital, and I have about 27 years in performing interventional procedures, and I will introduce the topic of carotid stenting today. The brain receives blood supply from 4 major blood vessels. So in the front of the neck, there are the 2 carotid arteries, and in the back, we have 2 blood vessels, which is called the vertebral arteries. Now, as we age, as we get older, slowly the walls of these blood vessels tend to get thicker. So why do they get thick? Because of deposition of fat, fibrous tissue, and calcium. So this is called atherosclerosis. Normally, this will happen in any patient as they cross the age of 60, and the older they get, the more are the chances of these thickenings taking place in different parts of the body. But if the patient is a diabetic, or if he is a patient who is in addition smoking, then the same changes start happening much earlier in life. Also, if the patient has a family history of developing diseases of the blood vessel, it can happen earlier. So how does a patient who has a narrowing in one of the blood vessels of the brain present? They present with a unique condition which is called transient ischemic attack, or TIA. What actually happens is, suppose we have a narrowing in a blood vessel, say on the left side of the body, which is called the carotid artery. A patient will feel numbness or weakness on the right side of the body. Or for example, the patient may feel sudden loss of vision, or one eye may get completely black and you may not see anything at all. So whenever a patient has this momentary weakness or numbness, which lasts for a few seconds, it is a warning sign, just like a patient who gets a warning sign of chest pain before a heart attack. The closest symptom that mimics the chest pain in the brain is transient ischemic attack. So when you have a transient ischemic attack, it's extremely important that you get yourself evaluated by a radiologist at the earliest. You have to do a Doppler study of the blood vessels that supply the brain, which is primarily the carotid arteries. So in the Doppler, you can see whether there is restriction of flow or not. When there is restriction of flow, we call it a stenosis. Thus, the stenosis can be minor or it can be significant enough to warrant a treatment. On the Doppler study, it's very easy for the radiologist to tell you whether the stenosis is 60% or more, and if it is 60% or more, then it warrants treatment. When it's less than 60%, we normally do not treat a carotid stenosis. So what are the treatment options that are available to a patient? Before we start a patient on a treatment to open up the block of the blood vessels of the brain, it's extremely important that his sugar is controlled, his blood pressure is brought under control, and if he is a smoker, it is mandatory that he stop smoking completely, because all these will add to the risk during treatment. And especially if a patient is a smoker, the whole device that we use to open the stent, the block may completely damage the system, and we may end up with a stroke. So going back to the treatment option, conventionally, to open the block in the blood vessel of the brain, we have 2 major pathways. One is a surgery, which is called endarterectomy, where a surgeon will put a nick in the blood vessel of the neck, then go into the blood vessel and take out that area where the fat and the fibrous tissue is deposited to ensure that the pathway is cleared once again. Till about 15 years ago, this was the only treatment option that was available. But today, thanks to newer technology, one can actually do this whole procedure without cutting the neck at all by a procedure which is called angioplasty and stenting. So how is angioplasty and stenting done? You may have heard of a procedure called angiography. Angiography is the technique of taking a catheter into different blood vessels of the body and injecting dye and imaging it under a system which gives us a recording of all the flow that is to be demonstrated and gives us extremely high quality images which can tell us exactly not only the location of the narrowing but also the severity of the narrowing. So if one has to do a carotid angiography, we will take a small tube which is called a catheter and navigate it under imaging guidance from a blood vessel in the thigh and take it all the way to a blood vessel into the brain or the neck, which is called the carotid artery. So what are the crucial elements there? A very well-trained doctor who knows how to handle catheters, extremely good quality machines, because poor quality images means poor quality of diagnosis, and of course the right anesthesia and the medication that are necessary to do an angiography. But now we are talking about going to the next step, and that is an angioplasty and stenting. In an angioplasty and stenting, the first step is to place a larger catheter, which is called the guiding catheter, in the main blood vessel which is to be treated. Once the guiding catheter is placed over there, through the guiding catheter, we'll take a fine wire across the narrowed segment and then initiate treatment. But the problem is, once we take devices like balloons and stents through the narrow segment, sometimes the segment may throw little bit of particles from the narrowing itself, which can produce a block in the blood vessels of the brain, and we call this as distal emboli. So how can we protect a patient from developing a distal emboli? So the way to protect it is, the first wire that we take has a filter that looks very similar to a small little tiny umbrella, which will filter any of the blood clots or the particles that arise from the narrowing to go up into the brain. So this is called a carotid protection device. Over the wire that has the carotid protection device, we take a very small slender balloon and we will open the narrowing to give us a passage which will be like 3 millimeters. But this is inadequate. So over the wire, after the balloon is removed, we take a metal mesh which is called a stent. This stent will not only open the narrowing but will also push all the fatty material to the sides, giving us a clear passage for blood to flow into the brain. Once the procedure is done, we take another fine tube to capture the filter or the umbrella, and once that is done, we'll take an angiogram and make sure that the patient's circulation is normal. Normally, patients are kept for a day or two in the hospital following this procedure to make sure that he is fine, his blood pressure is under control, and then they are discharged. The procedure is normally done under local anesthesia, and following the procedure, the patient will be advised to take a few medications which are blood thinners or antiplatelet agents. So the patient is advised to be on antiplatelet agents for lifelong, and sometimes we will also give him some cholesterol lowering agents to make sure this disease does not occur anywhere else. Can complication take place? Yes, it can take place, especially if the operator or the doctor who's treating you is not very experienced in doing these procedures. So it's important you know about the experience of the doctor, you know about the equipment he's using, and also you know that with all these also there is about a 1% risk of a patient having a complication, especially in the form of a stroke during the procedure. So sometimes, having done all this, it's possible that a small little blood clot can still go up into the brain. But like I said, it's only about 1%. So there is a 99% that you will sail through the procedure without any problem at all. Normally, these patients are not kept in the ICU following the procedure. They go back to their rooms. Only rarely, if there is a lot of changes in the blood pressure, you may be kept in the ICU. Also, after the procedure for some time, we will be pressing the point at which we puncture the blood vessel in the thigh, and because of that, you may be asked to keep your legs without moving for 6 to 12 hours. After the procedure is done, and once you're discharged, you can go back to absolutely normal life, except the fact that you should take your medications properly, and you should not forget to come and visit your doctor at least once in a month. So carotid stenting is a safe procedure. It's a procedure indicated when there is narrowing of the blood vessels, and done with trained doctors. You can be sure that you will go home safe with a very, very low risk factor.